Okay, we've got this fella. He's got this bilateral medial heel pain. It's been there more than a year. It's an intermittent pain, I assume?
It is intermittent, yeah.
Intermittent. Not worsened by any one thing immediately, but 3 to 4 days of accumulating walking, it might be worse. But better first thing in the morning. Anything else make it better?
Yes. He's seen a couple of therapists who were treating him as a problem of plantar fascia. They didn't think it was, or they didn't know about derangement. And so they were giving him exercises of a strengthening nature, stretching, strengthening, and he did find them of help. Mm-hmm. So I was heartened that they weren't just shoving electricity or needles at him.
Colin, when a patient describes some previous exercise and they say it was fairly helpful for me, what is your next question, or do you have any?
Well, some of the questions would be, does it help immediately?
Okay.
If you've got the pain and you do it, what effect does it have? I think that's a really important one, because there's not many systems. I think Mulligan is probably one, McKenzie's another, and there may be others I'm just not aware of, where therapeutic exercise, they've got a sort of a long-term goal. Look, if you do these some date in the future, you should start to feel better. Mm-hmm. Whereas the exercise I'm looking for is one that makes an immediate change. Mm-hmm. It's not always possible, but that in itself will help your diagnosis.
And if they affirm that, yes, when I walked out of that clinic after a session, I had considerable relief, what does that mean?
It suggests that it would narrow things down to probably, if we're thinking of derangement and the two dysfunctions, it would probably indicate more derangement, either spinal or more likely extremity, if the exercise was directed at that joint. So that was an interesting thing about this guy, because as I said earlier, many times if you do exercise to an area that has a spinal component, the person reports feeling worse. This guy didn't. He said it's helpful, but it's only helpful up to a point. Mm-hmm. I can't get rid of the rest of it. It's probably about 40% better than it was when it was at its worst, but I'm not getting the other 50 to 60% recovery.
I see. Okay. Where did you take your history taking from that point?
Just going through the form. Do you have pain at rest? Usually no. Disturbed sleep? That was a no. He had one other interesting observation, and that was that he'd noticed that before the onset of pain, he would start to feel a sensation of tightness or stiffness in that region, in the region of the heel.
And did he offer?
Month after month, new guest experts like Colin Davies presenting actual patient cases like this one and access to all the past. Check out case conversations at mechanicalcareforum.com.